Welcome back to the broadcast. Important that you be part of this discussion. 22047 is the SMS short cord. The number to call 0768095491. It's time for COVID-19 360 conversation as we take a look at the events of yesterday after the CS for Matters Health was, of course, facing the House to expound some more on these talks of corruption that has been, labeled or has been alleged to be within the health sector at this time that the country is dealing with COVID-19. So much money has been channeled towards dealing with COVID-19, but we still have issues. We still have medics complaining of not having enough PPEs. We still have Kenyans being told to pay for their own fee when they are taken to quarantine, when they are taken to isolation. Just what could be informing this? Is it that the country has no enough money towards addressing this? And just to give us a recap of the same, I don't know whether my team is ready with a clip or the very same story that we worked on the attendance of course, the CS in regards to expounding this. If you're able to get that clipped, please alert me, and then we'll be playing that just so we get a recap of the same. So joining me this morning is Kirogo Ndegwa, who's a lawyer, and also Dr. Ignatius Kibe, who's a doctor, yes, automatically a medical doctor for that matter. So we get to expound some more and we put some perspective in regards to the events of COVID-19 in the country. But not before I get to hear their take on the stalemate that we have on matters revenue sharing, because this in a huge way has also affected the operations at the counties. Matters Health being affected hugely at the level of the county, knowing very well that health is a devolved function. So Daktari and Wakili, good morning.
Good morning.
Good morning.
Good to have you, gentlemen.
Pleasure is all mine.
Come again?
Yes, I'm saying good to have you this morning.
Thank you very much.
All right, so Wakili, the Senate stalemate that we witnessed today, what do you make of it? And we have a 12-member team that has been set to help us get a solution to it. Yes. Is it likely to achieve something?
Yes. Thank you so much for that question. When we ushered in the new constitution 2010, people had expectations.
Yeah.
And among the expectations was that there would be affirmative action. That over the time, since when Kenya gained independence, there are counties or some sections of this country that had been left behind.
Right.
Hence, the issue of affirmative action really came into play after the inauguration of the new constitution. Now, then there also comes another issue of equity, such that should we now spend on land, because most of these places that had been left behind were not densely populated as others, and therefore it's a push and pull.
Yeah.
What should be the formula that ensures that every Kenyan gains, and ones that for the counties that have been beneficiary of the revenue sharing formula there before don't feel left behind. So in my view, I think it's time for us to now consider equity, that every Kenyan is supposed to we spend this money in terms of the population. But that's just my humble opinion. Yes.
All right. Well, Daktari, if you can hear me, the stalemate has been ongoing for a long time right now. As it goes on, like I said, there's a stalemate within or at the counties, especially within the medical sector for that matter. As we have this conversation, as this 12-member team has been set, are we likely to get a solution in regards to this so that we can have things moving at the level of devolution or at the level of course, the counties?
I believe so. I know that Kenya has a big problem of mixing up everything technical, medical, and politics. I believe that we politicize things that we shouldn't. Like we have now started politicizing COVID, the disease, which is a pandemic. It's not a Kenyan affair. So I believe there'll be a way around it. I know that we are going to succeed, because when Kenyan people reach that stage, they climb up a step higher. They no longer use the usual tribe and the tribal chauvinism and sectional and area. So sooner than later, I know we shall go through this. We shall succeed. I'm optimistic that will prevail. I also believe that we have exaggeration. You find something that has not been proven becomes a major topic, and it is not good. It's not healthy for the country that when somebody wants to spoil Linda's name, he comes up with a lie that Linda is a thief or Linda is this or the other, only for them to say, we are sorry, we didn't have sufficient facts.
Right, Doctor, yes?
I'm saying this referring to the mixture up of the issue of money, fiduciary, where they are now discussing money in the Senate, and they are also simultaneously discussing funds that have been stolen or goods that have been stolen and taken to Tanzania and resold to Kemsa. All these things, they are not connected. So we believe we shall go over this, and I believe Kenyans can climb a step higher and handle each issue separately.
All right. Well, thank you so much, Dr. Terry. For the records, Dr. Ignatius Kibe joins me on phone as we try to fix some technical hitch on his Skype, and we hope to get a hold of that. But all the same, we'll proceed with the conversation as we are able to get him loud and clear. So we are coming to COVID-19 360. And this is the latest report that we have today, that the death toll of health workers has hit about 16 of them, and 838 health workers are sick. And when we say sick, they have contracted COVID-19. One, we've had arguments on how best we've been able to take care of our frontline workers.
Yes.
And the conversation has been that they have not had the best. At this time when the country is battling with COVID-19, 5-6 months into it, we still have the same conversation, coming from the medics, complaining day in, day out that they are not getting the best of care, they're not getting the best of equipment. Yes. What does this speak, first of all, about the health sector in the country at large, even before we come to that level of COVID-19?
I think as a country we were not prepared.
Let's allow Wakili to weigh in, and then we come to, because I know this is an area of interest and it could be burning, yeah?
Yes.
Okay.
I think as a country, thank you for that question. As a country, I don't think we were much as prepared as we should have been. We didn't really have a strategy, and therefore what we have in our leadership is some kind of knee-jerk reactions. So we only attend to a problem when it arises, such that this problem is at one point in time overwhelm us. We are not proactive,
right? And
therefore, when the frontline soldiers, if I may call them, experience this problem, we only attend to those that complain, and where there are no complaint, then I think we let go. It's like we are, if I may call it, on a pilot mode, and that really is such a, I would say it's such a pity for our country. I really hope that the stakeholders may come together and come up with a strategic plan. I've not seen one that has been launched on how we can combat this. I've not seen one that is telling us how do we get to zero rate infection.
Right.
Unfortunately, it's always about, we are always reacting. Right. We are reacting. And therefore, the problem will always be ahead of us.
Okay.
Yes.
Well, now looping in Dr. Terry, having these numbers on the rise, or as to the medics that continue to succumb due to COVID-19, and the numerous of them that are sick or have contracted the virus, what does it speak, first of all, of the health system? You probably are in a better position to tell how it was and what are the likelihoods that we're going to experience changes.
First and foremost, Linda, I believe that the health sector is not properly positioned, because we place this very important sector, call it ministry, in devolved government, in the devolved sectors. And I believe that this should be centralized. I still believe that procurement of drugs and procurement of PPIs, personal protection equipment.
Actually, these numbers have highly been attributed to the lack of the same.
Numbers. Which numbers did you speak about, Linda?
The numbers of course, the deaths of frontline workers, and also the numerous numbers of them who have contracted COVID-19. This has highly been attributed to lack of personal protective equipment, like you say.
Yes, that's what we say, that there should be a centralized system, because after all, the COVID found us unawares. And because of the fragmented health system that was devolved, I think there was no, like Wakiri said, a central planning committee. So you find every institution, every county government, every medical institution like Kemri are doing it their own way, the best of their ability. So there should be a central command and a central store for purchasing of PPIs, PPEs, and also for standardizing what we are receiving. As it is today, you find even simple things like face masks have all different standards and all different specifications. So I believe that we went the wrong way the minute we did devolve the health sector.
All right, well, that's an interesting view, a view that we've had for the longest of time, the argument that health couldn't have been devolved in the first place. Are you of the same idea? And do you suppose that if all this was being run at the national government, we probably could have had a solution? Many have argued that maybe we need a health commission, just like we have, the Teacher Service Commission. But things have not been easy also on the teachers' side.
Absolutely. I actually... Okay, if I may, I think devolving of the...
But Terry, just hold it right there. Let's get to hear the take of Wakili on the same, and then we come back to you.
Okay.
Yeah.
Now, health sector, if I may, is a very sensitive sector in our republic, and it actually involves issues of life of our citizens. Yeah. So when, for instance, the doctor is not paid, is not given proper working conditions, then that also puts the lives of our citizens into the risk. Devolving health as a sector was, I would say, as a matter of fact, it was a miscalculation for us as Kenyans. First, experience will tell us that over time, this sector have had chaos. Doctors issuing strike through their union, and some even not, some counties not even having the capacity to run the sector, and therefore, when COVID-19 came, it actually found us at a crisis. Therefore, it was actually most counties, as I understand, are yet to even comply with the containment measures. They are yet to put in measures that can help in case should the number surges we have seen over time. It would be very hard for these counties to really handle the numbers, to really handle the influx of patients. And therefore, I think even if we were to devolve, we ought to have given it time before the functions could be devolved and before the functions could be transferred. And that would have helped us as a country to put in structures, to put in systems that will help administer the whole sector. Unfortunately, then we must learn from our own mistakes.
Right.
Yes.
Okay, well, and speaking of which, now coming to you, Daktari, since the first case was reported in the country, the argument was that most of the people have shunned from going to hospitals because of fear of contracting COVID-19. At this time, by the time it was July 15th, we only had about 429 cases. Today, we stand at 838 cases. I guess we lost Daktari, but all the same, I'll come to you, Wakili. And, you know, looking at such a scenario, most of the patients are running away from hospital. Yes. And this is likely to culminate even more in the event that these numbers of medics with COVID-19, you know, rises. Yes. So what way forward? Are we going to channel ourselves, or are we going to squarely go back to that aspect of home-based care in totality? And just how much is this going to work in favor of us as we try to tame COVID-19?
Thank you so much for that question. I'm looking into a problem where, you know, we are like handling an enemy in the dark. We don't know where it will hit and who really. So what if for instance Kenyans were told to go to these public hospitals? In the first instance, we had like an experience of what I may call exploitation, that you when you go and you're tested, you have to go to a hospital and you are quarantined for 14 days, you are supposed to pay a huge amount of money. Therefore, most people even fear that even when you have almost all the symptoms are showing, you'd fear going to a hospital for fear of, one, the economy. You don't have the financial capability to pay for the bills. Number two, you may also consider yourself as having a good immune system and say, I'll fight this one and I'll win it. Rather than going to hospital, then probably for you to get worse. Then the other thing, I also had an interesting view. I had an interesting view from a friend of mine in the medical profession, and he was telling me, since most social joints are closed, we don't have clubs, you know, bars, and you know, most people are at home. Therefore, the risk exposing yourself to the germs and, you know, the viruses and the bacteria has since decreased. Therefore, people are not getting as sick as before. But on the issue of contracting COVID-19. People may prefer getting treated at home than going to hospital, which are first of all disorganized. The experience for most of us who go to these hospitals, you'll find sometimes you are neglected, there's some sense of medical negligence, so you'd prefer treating yourself from home. Yes. And hoping that, you know, the God that we pray will fight your battle for you.
Speaking of it, in fact, most of the people, even, you know, like, you probably self-diagnose yourself. You feel like you have all the symptoms possible, and you can almost say that this, based on what it is that we've been told, is COVID-19. So then you'd rather start, you know, self-medicating yourself. Plus, anyway, there's no particular medicine to COVID-19. Do we have Daktari?
Yes.
All right, so Daktari, first of all, I'd love to hear your take on the same as a medic. What are the dangers of people, you know, feeling like they have all the signs and symptoms, but because of the fear of the unknown, the fact that even the medics are being recorded to have very, you know, like many of them to have COVID-19. So there's that fear of even hitting the hospital to get medical attention, or even to get tested for that matter. So what are the dangers of choosing to stay at home? You know, self-medicate, take as much lemon as you can, take as much ginger as you can, and opt not to go and get check-up or even be tested.
It would be foolhardy. It would be very, very, very foolish of a person, whether sick or a lame man, to get sick and stay at home. And I believe on one side that the Kenyan government, through the Ministry of Health, has been offering sufficient awareness, sufficient information on people, how they would or they should react when somebody gets the faint light of symptoms. Then we call upon all Kenyans to take personal responsibility and not to wait for anybody to go and help them. Let them call for medical assistance. In fact, we have been told that if somebody suspects or people around you suspect that you have COVID, stay put and call for medical help, because if you try to go look for help using public transport, then you go infecting everybody. So if somebody gets any of the symptoms, you should stay put and call for assistance. I repeat that I think our government has given more information than any other government, including America, that this is how you should behave.
But amid all this information, Daktari, allow me to ask this. Allow me to ask this, Daktari. Yes, there's this information out here, but just why are we still grappling with stigma?
This is kawaida. This is the usual of Kenyans, that the fear of the unknown. And this fear of the unknown is ingrained in us as people, that I might go and get or get deceased when I go to hospital, not knowing that it is worse if you don't go to that hospital. So it is the fear of the unknown. Kenyans generally fear where there is a conditional life. Even Kenyans generally will fear policemen, whether they have done a crime or not. They don't want to go near a police station or a court of law. That is usual with us. And for COVID, it's like I said, foolhardy. It is to say the least, and to use a bad language, stay at home or to hide away from the fact that one is sick. You find many of us would want to stay even with a chronic illness without going to see a doctor for fear of the unknown, for fear that if somebody goes, even during the time of HIV, and if you find people who knew very well that they had HIV and AIDS, and they chose to stigmatize themselves, self-stigma, and they refuse to go to hospital. It's not wise at all.
Okay, well, interestingly, Wakili, even the learned, I don't know, well, in their own respective capacity, will tell you that this, with all the information, there's still some level of fear. What really is the underlying factor? As the Daktari says, it's a common trend with Kenyans, but why does it get to that point that even when you are well learned, even when there is this information at your disposal, you still go to that level where you stigmatize? You do not stigmatize, you're so scared beyond, even when it's not necessary. Sometimes you literally feel as though you have COVID. I don't know whether you've experienced that. You really literally feel like you have COVID-19, yet you honestly do not.
Yes, it's. I think it's just human nature, the fear of unknown. Just like when you are a young child, when the true nature of human beings that would come out. When you are left in darkness, you probably cry. Now we are fighting an enemy that we don't know, and it's an invisible enemy. We've not found the cure yet, and therefore, and actually, people will fear getting any close, any proximity towards the disease. So even when you are probably well informed and you exhibit all the symptoms, it would be really hard for you to now come step forward and tell the people, I think I have a COVID-19. It would require some special courage. It's just human nature. I don't think it's per se related. It may not be dependent on a person's exposure to knowledge or to just the information that is being dispensed by our good government, but just the human nature that you get stigmatized. Probably if you are in business, your customers will run away from you in fear of contracting the disease. Yes.
But as time goes by, do you suppose then that we are probably going to get away from that, because we've seen high-profile people coming out to declare that they are COVID-19 positive?
Absolutely.
And something that has been received so well, so to speak, and them being told poorly and all this, and people receiving this well. Do you foresee a scenario where now we're going to run away from this kind of stigma to a point whereby we're going to accept and we'll know that, well, this is just a virus like any other, and it's not something to get you thinking ill of the other party?
Absolutely. I think we're on the right path. We probably had there human beings have a way of adapting. You probably see people coming out say, sorry, I have COVID-19, and just like HIV, when it began, people are actually running away from the real patient. But now, if, for instance, someone in our workplaces told us that, I'm HIV positive, we probably support them and tell them, Paul, it's not the end of life. People have survived with it. It's just human nature, and human beings have the tendencies to adapt to changing circumstances.
Well, I agree to that. Now, we have seen most of the patients and most of the people who've been quarantined complaining that they are being forced, first of all, in quarantine. It is taking ages before they are let out. For instance, you go there 14 days, you're tested, you're negative. Again, you're told to wait for 21 more days, for tested, you're negative. Some more days, tested and negative. Dr. Harry, coming to you, what really informs this? Is it because we have, yes, the discrepancies on the testing, but why is it that one would be kept for this long by the government without them coming to probably release the ones that are, have been termed as safe and not having contracted the virus? And, to a point whereby we see scenarios of some of them actually getting to that point of contracting the virus while they could have been saved prior.
No, the way this virus goes around is that it is in phases. There is something that we call the viral growth curve. Mm-hmm. And in this instance, we've been told it is a 14-day cycle. Yeah. So when somebody is proven to be asymptomatic or has no signs and symptoms, mm-hmm. We are not sure until we do the second test. Indeed, even for the other ordinary tests, even malaria, even intestinal worms, mm-hmm. and even for blood tests, we like to do it 2-3 times. Because once is not enough, it could be a fluke. Yeah. So it's unfortunate that at one stage, we had problems with the supply and demand of the test kits, but it is useful for us to repeat these tests. Mm-hmm. And I would encourage those who are in quarantine, self-quarantine or government quarantine. I would probably want to say that it's good to go for second and third and even the fourth test. We have had even in those pictures like we just mm-hmm. mentioned about HIV and AIDS, we've had false positives. Even in ordinary diseases like syphilis, we have had false positives and false negatives. Even in typhoid, we have had false positives and false negatives. Yeah. So in order to contain the disease, in order for us to restrict movement of the person, remember, the virus per se does not move. It is people who move it. So if we allow you to go when you have the slightest or the slightest of suspicion that you may not be completely clear, is allowing you to go to your parents and to your siblings and to your relatives and friends. And this could end up with spreading. And this is why we invoke new and old law, including a Public Health Act, that even ordinary leader, even when somebody has TB, yeah. sometimes we confine them in the prison or in a certain place so that, especially if they are not adhering to treatment, we confine them. It is usual worldwide that if somebody is suspected or is slightly positive, and this is a highly infectious virus, mm-hmm. we need to contain them. And where are they going in those 14 days? Why the hurry? So I'm insisting that it is very important to do 2, 3, 4 tests. Why not?
Mm-hmm. All right. Now, speaking of which, the aspect of cost comes in, because you won't do 1 test, 2 tests, 3 tests without costing me, and every other test is costed differently. Most of the Kenyans will tell you that probably health is an issue. And I mean, like you say, sometimes you don't even want to go to hospital because you're looking at the cost yes. versus, what it is that you're going through. You'd rather stay and struggle at home and see whether you're able to get, healed, or even go over the counter and buy some medicines from the chemist. So looking at this scenario, there's been a conversation revolving around this of how unfair this can be. Any legal backing, first of all, that would protect, say, a patient from, probably getting tested and say that, I do not want to be tested. Any legal backing that would protect them from saying that, this is too expensive and I'm not able to cater for this. Yes. Kindly have the government step in or chip in?
Yes, thanks so much for that question. I'm looking at Article 43 of the Constitution that guarantees every Kenyan of the right to highest attainable standards of health and to emergency health care. And that would entitle as a Kenyan when, for instance, you are diagnosed with COVID-19. And you don't have the capability to settle the bills, then it's upon the government to then come step in and say, you have this right, and we'll be able to cater for it. Anything short of that would actually be an onslaught on the rights of Kenyans. That's each individual. But just something that you had mentioned with Daktari on the issue of restricting people's movement, like quarantining them, putting them in quarantine facilities. There are also costs involved in that. And there was an issue when COVID, when we had the first cases of COVID-19. There were issues of people being, grouped up in a single, non-standard places, and they would even end up contacting the disease. People who are otherwise not sick with COVID-19 would end up contacting the disease because of first the conditions were not safe, and the government was not sure where do we put them. They had not really put in place the measures to the places to really quarantine the people. And there were issues with a facility in Kenyatta University, such that people are even contemplating committing suicide. I mean, all this is an onslaught on the rights of the people. If you cannot be, holed up in one place and you are told wait for another 14 days and it's still billed to you. I mean, they say he who calls the tune pays the piper. They are the one who call the tune. They should end up paying the piper. But be that as it may, it is also our individual responsibility to ensure that you are also safe, such that the government would only play a complementary role. Yes.
Okay. Well, I'm trying to look at all this possible stuff that have not been expounded on, and Daktari, coming to you, it has now officially been declared as that lonely condition, or that lonely virus, where once you get COVID-19, it is you and God. Some of them will tell you that they've been somewhere, they've never been visited for ages, 21 days, 20-something, 40-something days, amounts to all these days without probably seeing your partner, without seeing your relative, without seeing your friends. I mean, are we likely to experience a scenario where we're going to shift from that? Or maybe the home-based care would probably come in handy towards ensuring that people do not feel as lonely?
Finally, people understand, if say this is a new virus, a novel virus, and we had no experience whatsoever. It appears like some senior people you hear in USA, even former presidents like Obama and like Bill Gates talked about this virus or a similar virus 5 years back. But what we are talking about is novel, it's absolutely new, and in the circumstances, I think our government has done its very best. I go around the world on telecom and what we call cyber medicine and telemedicine. And I find Kenya is among the very best in as far as information transmission is concerned. What we may not be doing is having the what we call from the beginning standards. You find some policemen, for example, who put 20 people in a Land Rover and drive them to a place of isolation. It is wrong. Or even confine people in a cell. It is wrong. That would in fact increase the very virus that one was trying to fight or to work against. So it is very much in order that people can quarantine themselves. This is what our minister keeps on saying. It is now God for us all, and
every man for himself.
His own. So it's not good to expect that somebody will come and help you. Help yourself, and it's important that everybody also quarantine themselves in their own houses or their premises. And it is also wrong for people to be put together in like a caged system, like a zoo.
Yeah.
It will increase the risk of contracting this virus. It's also very important to teach people, and this one, I must say, is a challenge to our government and to our individuals to talk about diet, talk about immunity, boosting our immunity, because this virus, many coronaviruses are several, and it's like when we get cold, in the ordinary cold or influenza, and those people who have high immunity, and this immunity will be through good food. You find we keep on talking about vitamin C, natural vitamin C from orange, from kiwi fruits, from green vegetables, broccolis and spinaches. It's very important that our people not just quarantine themselves, but also take the proper immunity boosting food. We also include what others talking about. You find that somebody in our neighborhood say, my son alikuwa na hii, and my son had this virus. Nikampatia limau, nikampatia kiwi fruit, nikampatia turmeric, na nikampatia sijui jija. Tujaribu haya mambo. Let us try these things, and our government should also take responsibility and talk about diet and stay in a clean environment. I know there are problems, Linda. We have problems because sometimes the setup of our homes is that we live in small rooms. A whole family of 6 or 7 are living in squalid or small places. But then let us do our best. Let us also eat well. Let us expose ourselves to a clean air and a clean environment. And we shall conquer. I am confident that we shall conquer this virus.
Okay, well, amen to that. You speak of this at a time when Kenyans are grappling with tough economic times, some of them can barely enjoy a meal, breakfast, let alone lunch or dinner. So in as much as we're talking about eating healthy, keeping ourselves safe, looking at the slums, honestly, the houses there, you find like 4, 5, 6 people living in one house. Just how possible is this for us to be able to attain? And then at what point then does the government coming to us, cushioning us as a country, and how capable is the government to able to cushion us at this time of COVID-19, Wakili?
Thanks so much for that question. Talking of there's something we call autochthony. There has to be some homegrownness. If you want to apply the measures put up by the government of United States of America to Kenyan population, it definitely would not work. In just the same case, the kind of measures you'd expect to be employed in a place like Karen or Rwanda, the leafy
totally different,
yes, it would be very different from the ones we'd employ in a place like Korogosho. And actually, even the amount of resources you'd expect to be employed on people from the leafy suburbs and from the other side of the town would be completely different. What I'm saying, for Kenyans to really overcome, then we must wake up to the reality that we are all differently enabled.
Right.
For a person who is sharing a 10 feet by around 10 feet room for a home with around five other people, definitely on issues of issues of quarantine, it might be self-quarantine. It becomes very hard. And therefore on issues of whether we can how we can really help other people, whether the government, how the government can cushion people who are is not capable.
Yeah.
Then the government needs to rise up to the occasion and now say we need to separate. Let's look at different situations differently. Yes.
Okay. Well, and let's come to the events of yesterday. I know we cannot discuss COVID-19 and fail to discuss that. Corruption is what is in the mouths or the tongues of many right now, Dr. And yesterday, Health CS Kagwe, appearing before the Health Committee in Parliament or the National Assembly, came out to defend the Ministry on COVID-19 funds. He says that the matter is now with the DCI, and he says that they probably have consumed or have received 15%, probably painting a picture of, what more than meets the eye. In a scenario where we all thought that it's about the health sector, there's probably an extra hand or an external hand that has been part and parcel of fleecing this money that has been there. Reality is that there's that acknowledgement that money is being misused. When you look at the events of yesterday, what do you make of the fight against COVID-19? What are the likelihoods that we are going to successfully hit this or beat COVID-19 in the event that we still talk of COVID-19, corruption allegations on monies that are supposed to be channeled towards addressing the virus in the country?
Linda, they say that when war breaks out, and we are at war, and we've been reminded that we are at war. We've been told there is a new normal. When there is war in a country, there are hikers who become very fat, and they give birth to triplets because of these causes.
Yeah.
And if you ask the hiker, they would want the war to continue for longer so that they eat the corpses. So there are very many people who come out, called billionaires, called millionaires. God forbid. And we need to catch those people who will corruptly take money which was meant, like Wakiri says, money for people in the slums, and they steal it, and they are already themselves rich. Yeah. These are the hyenas of war. Hyenas who give birth to twins and the triplets when there is war because they are eating corpses. So when a situation like this arises every time, there are people who take advantage. I don't know. I don't want to comment because it is probably too early, or it could be people exaggerating by coincidence. It's a funny coincidence that we are discussing money at the Senate, and then we are also discussing items, equipment, and drugs stolen at Kemsa. So it is very unfortunate that the two discussions are taking center stage at the same time in our country. But I dare say, if we had a centralized system, and if we had probably created a multidisciplinary committee, the multi-ministry committee to fight the coronavirus, probably we would at least put a shield or protect the funds that will be given by donors and tax from people. Like Wakiri said, I want to repeat that it is the owners, the buck stops with the government. Anybody who cannot afford even to quarantine themselves, it is the owners, and the responsibility is on the government.
Okay.
And let us get the anti-corruption commission and all protective arms of the law. All oversight organizations should be included in a committee that is multidisciplinary, and that should take care of COVID. One thing I want to say, Lita, I don't think COVID will go completely. It will just die out slowly, but it will remain with us. HIV and AIDS has not died out completely, so it will be there with us. So it's time that we formed a COVID eradication or control committee.
Okay, well, which is interesting. Just looking at that aspect, we are talking about devolved systems, and I think, like I said earlier on, the complaints are real from across quarters.
Yes.
With these reports of corruption, just how possible is it for us to be able to put our hands on something and say, you know what, even the DCI, the DPP, the judges, or the courts, the police forces, to put their hands on these activities and say that, you know, on this one, yes, there is a corrupt activity, because you see also from the utterances of the CS, while
yes.
one would argue that those are the facts, there is also that aspect of, you know, shifting blame from the ministry to this other side, saying that it is not us, it is not me, and all that. So in a scenario where we are having the counties that are dealing with health, we are having the Ministry of Health dealing with health, we are having the national government also coming in, because after all, it is time to deal with COVID-19. We are having respective quarters coming to deal with COVID-19 in the country. Just how possible will it be for us to put our hand on the people who have conducted corrupt activities courtesy of fighting COVID-19 successfully? Because, I mean, just that is the biggest question today.
Thanks for that question. Linda, this comes at a time when I actually, let me come out with a confession. Yesterday, I'm actually dealing with an issue between EACC and the DPP.
Okay.
As at yesterday, most prosecutors at the Director of Public Prosecutions are out. It's either there is huge infections, the high rates of infection at the DPP's office, or that they are fearing for the same. Such
or they've taken advantage of the fact that, well...
most probably. But then that also weakens our system, such that as at yesterday, the information that I got from the Ethics and Anti-Corruption Commission was that there was a virtual meeting on how matters anti-corruption would be dealt with, whether it would be done virtually. Normally when you go to court, you'll attend, the accused person had to attend court in person. Now we have seen a paradigm shift. We are actually, the pleas and mentions are being done virtually. So it's also a serious issue. Now this coming at such a time when we are fighting two enemies, and the most vicious being corruption, puts Kenyans at a huge risk, such that yesterday I had a discussion with a friend of mine. Someone was telling me that in public offices, when you do a roll call, people are likely to either they are wondering, do I say not guilty or present? Okay. So there's huge corruption, and actually the minister has actually has said it himself that there are fair share of criminals in his ministry. So where there is smoke, there must be fire. And KEMSA recently also sent their CEO and procurement officer on leave pending investigations. Definitely there must be something, even if it is not an issue worth prosecuting. It is an issue that touches on a person's integrity. When we inaugurated this constitution, we were hopeful that Chapter 6 would deal with issues of corruption at public offices. Unfortunately, we have seen a lot of dragging, a lot of fight back, and that finds us where we are today. Such that at this time, when even the conscience of a person would dictate that it is not the right time to steal, it is not the right time to embezzle public funds, the experience will prove us wrong on that. That people are willing to do anything to get rich, whether it is on the account of lives and the well-being of other people.
And I keep saying this, we probably expected these millionaires to crop up later, way after we probably have known ways and forms of dealing with COVID-19, but they're cropping up as early as now, and the country still grapples with the fact that the people are not able to pay for their medical, expenses. And truth is that we had a report yesterday that you'll be forced to pay for your medical expenses in totality in the event that you are taken to isolation or you're taken to quarantine. So looking at this, what are the likelihoods that we're going to have the legal backgrounds coming on board to solve the situation for the people of Kenya today? Amid all these tough talks where we always say, we hear the judges saying, or the courts saying that, there's no valid evidence for that matter.
Absolutely. Two are the paramount consideration that should be made. One, the public interest, and number two, the evidential. Yes, there could be a lot of truth in what people are saying, but it's up to the investigative agencies and the prosecution now to come before and actually to bring these culprits to court and charge them and prove beyond reasonable doubt that they have actually perpetrated the acts that are alleged against them. More often than not, people end up getting free for a basic reason that every person is presumed innocent until otherwise proven. And the proof that a person has indeed committed that crime that he is charged with has to be really bolstered by the evidence. And I'll not lie. So most of the time, these things, when you release a person on bail and they get out here, you see there's a lot of tampering with evidence and all that, and therefore these cases end up getting frustrated. Most of these scandals that we have, since the Golden Bag scandal all the way up to now, I hear what is now commonly taking the shape of mafia house scandal. May end up we may get very, very few convictions, if any. Because of that huge burden. Yes.
All right. Well, Dr. Terry, coming to you as we get to wind up on this subject. Insurers have also, run away from this. So Kenyans are staring at, a crisis. Kenyans are staring at, troublesome future. And this gets people, even when there's that clarion call for mass testing, this gets people running away from that. As we talk of a possible surge by the day, as we talk of hitting the peak, which we're not even able to know how because of the discrepancies on mass testing, what way forward?
One thing I like, Leader, is that the COVID pandemic is, and we must look at it as an international problem, is not as serious as one would ever imagine, because even the death, the percentage of death is very low. We have had diseases, we have had pandemics when the percentage of the population is as high as 30%. This time it is not high. And the other thing that we have an advantage of is that COVID is only at a maximum of 1 month, and then the issue is over. And we also, either succumb or you go home. So it is not a lengthy problem. It's not even like HIV and AIDS that is lifelong. So the insurance industry should not fear. The insurance industry should actually be part of the solution of this problem, and they should not at all obligate or refuse or ignore the fact that it's a pandemic, it's nobody's wish. And they should tackle it head on. I believe that insurance
not so clear. I guess we lost Dr. Ari, but anyway, on a very good note where we're almost winding up. So when you look at such a scenario, what way forward as we wind up?
Yes, on issues of the insurance covers and all that, you see, insurance companies like a business like any other.
Yes.
So it's all dependent on the clauses that are put in the policies.
Yeah.
So as you take a medical insurance cover, you also need to look at the terms.
Which in most cases, I hear they say, most of them are not set to deal with pandemics. To insure pandemics, yes.
Absolutely. And it's only a wait and see. The good thing is that, as Dr. puts it, that the mortality rate is rather lower. Lower than against many people's expectation. And it's a good thing for us. Now, on the way forward, how do we then overcome this issue? I think for starters, it's like they say, safari ya kesho utayarishwa leo.
Right.
Now, we need to sit down and look at where are we? Where did we intend to be? So that we come up with a strategy on how we get to zero infection rate. I understand countries like Qatar have zero infection as it today. They have since contained the disease, and of course the containment measures are still being observed. But can we get there as a country where we can put in measures and all the stakeholders come together? You know, we do a joint approach on how to curb this pandemic, and come up with a strategic plan. What do we do within the first 10 days, the next 20 days? And hopefully, if we all are observant of those measures, then hopefully we'll be able to curb and things will get back to normal, we'll be able to redeem our economy. But something of good note, I understand some countries such as Russia has come up with a vaccine, and we can only wait and see whether it will work.
Fingers crossed, I agree. Yes. Thank you so much, Wakili Kirogo Njegwa. It was great having you this morning. We also had Dr. Ignatius Kibe, and that's where we get to wind up this segment. I don't know, Dr. we are able to get your last sentiments in regards to the same in a minute or so? All right, we lost him again, but all the same, thank you so much, Wakili. That's where we get to wind up this segment. It was great having you, and thank you so much also for the feedback. We get to sample them as we proceed with the broadcast on the next segment, where we talk matters relationship. It's all about lifestyle. The question of the day is, how do we navigate and step out of toxic relationship, or not necessarily step out, but just stay afloat and ensure that you make changes so that this relationship becomes something that is good for you, what it's supposed to be. After this short break, it's going to be a conversation that you do not want to miss out on. We'll have a psychologist on board and also another guest who will also be taking us through and also probably sharing their experiences in regards to the same after this break.